Now we'll quickly look at the next stuff here, which we'll be discussing, and this is all around the area of thermal and electrical bonds. Okay, thermal and electrical bonds. So for thermal and electrical bonds, you just have to do it. You have been exposed to heat or electricity, so it could burn you. You understand? So you should know that thermal bonds are caused by external sources, heat sources, right? It could be flames, it could be hot liquids, it could be steam. While electrical bonds is basically caused by what? Electricity is passing through the body. Do you understand? So often to damage the deeper tissues beyond the skin, and well, the both of them could be dangerous. So let's look at them one by one. So when you say there's a thermal bond, you just think thermal simply means heat. Most of the time they talk about thermal as what? High temperature. So you can get that heat from fires, you can get it from hot metals, you can get it from boiling water and steam. So the heat rises the skin and the tissue temperature, leading to cell death, blistering, and also charring. So in appearance, you have a reddish swelling, blister, or blackened skin, depending on the severity. So risk is fluid loss, infections, and scarring. So the first aid you do here is basically to cool the bond with a cool, you understand, you tilt the temperature from being so high to being low. Okay, so you cover the heat with a sterile non-adhesive dressing. Avoid applying butters, oils, and creams. Okay, so bonds. So how about an electrical bond? Electrical bond just simply means an electrical current was what actually passed through there. It could be the AC current, it could be the DC current. So the current is traveling through the body, it's generating a lot of heat. Generating a lot of heat internally, and is damaging a lot of tissues, damaging a lot of nerves and even some organs. Okay, so that's what we got. Appearance, you have entry and exit wounds on the skin. That means you have the wound in the place that the current actually went in through the body, and you have the wound at the place where the current went out. So risks, it could cause cardiac arrest, it could cause respiratory failure, it could cause nerve damage, muscle breakdown. First aid is basically to ensure that the power source is turned off, and you call the emergency services immediately. You keep monitoring their breathing and pulse, and you cover any visible burns with a sterile dressing.